women's health.
This segment sponsored by Continental Clinical Solutions.
So we've been hearing a lot about endometriosis.
But unless you're directly affected, you may be wondering what this condition is. Well, joining us this morning to teach us more is Jennifer Nelson from Continental Clinical Solutions. So welcome.
Thank you very much. Glad to be here.
Glad to have you. So tell us, what is endometriosis?
Endometriosis is when the tissue that lines your uterus starts growing outside of your uterus in your pelvic area.
Okay. So what are some of the symptoms that you would feel?
Symptoms can vary from woman to woman, but typically they report pelvic pain, back pain, fatigue, nausea, and the pain can be so severe that it impacts their day-to-day functioning. Women that I've spoke to have reported that it has affected their productivity with work and school. It's negatively impacted their relationships. It's caused isolation and depression and even anxiety.
Absolutely.
It's terrible. So how do you treat it?
Currently, there are medications that help with the pain associated with endometriosis, but there is no treatment to directly treat endometriosis. There is no cure. There's also the option of having surgery to remove the endometrial tissue, but it's invasive, so not all women like to go that route.
Okay, I hear a lot of people talk about it. How common is it?
1 in 10 women will be affected with endometriosis.
Wow, okay, so I see we have a couple tips up there on the screen, and then it can also affect fertility?
It can, yes.
Okay.
And so if we feel like we're dealing with this and the pain is abnormal, what should we do?
You should definitely talk to your doctor. Unfortunately, women, it usually takes them 10 years to have the formal diagnosis.
Wow.
It's diagnosed with a laparoscopic surgery, which is invasive, so doctors don't tend to jump to that option right away. They may prescribe a birth control to help with the pain, but definitely talk to your doctor and get some suggestions.
Okay, and then there are clinical trials. Talk to us about why
Yes.
they're important.
So at Continental Clinical, we're running a couple of different clinical trials for endometriosis, and the goal of these trials are to try to help treat endometriosis. And we were just looking for participants. It's difficult to find women who have had that laparoscopic surgery to diagnose endo.
Okay, so if people want to get in touch with you to figure out what you're doing or to find out more about the clinical service, clinical trials,
Yes,
where
so
do they
you
go?
can look on our website. It's continentalclinical.com.
Okay.
We're on all social media outlets, Twitter, Instagram, Facebook, so you can check us out there as well. Yeah, and then just submit your information. We'll give you a call.
That's great. And the more we talk about it, the more people might realize that they're going through it.
Yes.
And the more we can get the word out, the more people who are in research. So
Right.
thank you so
Absolutely.
much.
Thank you.
for being here with us today.
Sure.
All right, stay with us.